Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnekins. Joining us this afternoon is Pepin County Health Officer Heidi Stewart as we get an update on the flu and also on COVID-19. And Heidi, thank you for joining us this afternoon. Well, we have the flu starting to appear here in Pepin County.
Yeah, I know that I've shared it on a couple different calls. I've shared a slide that shows a little bit of an uptick in influenza statewide in Wisconsin. I would say that that's also very true for here in Pepin County. If you look at nationwide or statewide numbers, the influenza numbers are still below the baseline, the average. And as we all know, there were very few, hardly any cases of influenza last year, but that doesn't appear like that's going to be the case this year. We've already had, in a press release that I released earlier today, in working with the hospital, we've identified at least 10 cases of influenza in Pepin County residents in the last week. Actually, that was effective yesterday, and the date we started looking at was the 9th. So it was actually less than a week. I haven't received any additional reports today, but this is cause for concern because we are seeing this it's the influenza A H3N1 and 2 strain spreading pretty quickly. Historically, this strain of the virus is a little bit more aggressive and causes a little bit more significant illness than other ones. It also tends to break through the vaccine a little bit more than some of the other strains. So some cause for concern.
Now, okay, we also have the COVID pandemic continuing. Are there similarities between the two? Because people might be like, geez, do I have COVID? Do I have the flu? Do we have similarities and differences between the two?
Yeah, so COVID, influenza, RSV, all of these cause very similar symptoms. They're all contagious respiratory disease, all caused by a virus, spread easily through droplets. So when somebody infected with COVID or influenza sneezes or coughs or even talks, the particles get into the air. Those particles can then transfer to somebody else directly to their nose, to their mouth, to their mucous membranes, or we can touch a surface and then we can touch our nose, our eyes, and it can be spread that way. In some situations, the particles can be suspended in the air and they can be breathed in. So the mechanism in which these viruses spread are very, very similar. The signs and symptoms that these viruses cause are also very, very similar. A lot of times there can be fever, cough, shortness of breath, sometimes difficulty breathing. A lot of people are reporting some fatigue, more than usual, sore throat, runny nose, stuffy nose, excuse me. That's a perfect example of how to cover your cough and cough into your sleeve. Sorry about that. Muscle aches, headaches. In some situations, we're seeing some nausea and vomiting. Those are all signs and symptoms that can be associated with both of these. So how do we know which one it is? We don't until we go in and get that test. And we're fortunate here in our community that Advent Health, along with some of the surrounding facilities, can collect one specimen, take one swab and run it on the machine, and that machine can differentiate which virus it is that's causing that illness. One of the differences that is still holding very, very steady is the loss of taste and smell. That is only associated with COVID. That is not something we see associated with influenza.
Now, while COVID and influenza have a lot of similarities, a lot of the similar symptoms, the vaccine for COVID is not going to work on the flu, and the flu vaccine is not going to work on COVID, right?
Yeah, they're different. They're different viruses. The spike proteins are different. The way that the vaccine attaches or the antibodies attach and cause protection are different. So that's not something you can say, I got my influenza vaccine, I'm going to be safe for both, or I got my COVID vaccine, I'm going to be safe for both. We encourage people to get both their COVID and their influenza vaccine. Those vaccines can be administered at the same time. If you're going in for a COVID booster and you haven't gotten your influenza shot yet, you can go ahead and do those both at the same time.
Talking with Pepin County Health Officer Heidi Stewart. And Heidi, with the influenza vaccine or the flu vaccine, it's right now is still it's okay to get it now, better than waiting until February, but really people should be getting it now, right?
Yeah, so and the influenza season varies from year to year. Sometimes we see the peak early in January. Sometimes we don't see the peak till later in March with the influenza season. So it's best to get it early. There's belief that lasts for, that 6-month period when we have the seasonal influenza season. Much like we're seeing now with COVID, vaccines do wane over time, and that's the reason for the current booster recommendations. So that's also the reason why we have to get a different influenza vaccine each year. That immunity starts to wane over time, and the viruses that are the specific strains of the viruses that circulate each year can be a little bit different.
Talking with Pepin County Health Officer Heidi Stewart. So Heidi, this increase in the flu, is this just in the general population, or is this coming from the schools, with students? And, because sometimes when this starts, it seems like it goes, like colds always seem to go through the school really fast. So where are we seeing this uptick?
Well, and any of these viruses can spread really quickly in any settings where there's a lot of people together. So congregate settings where people are together, particularly in the state of Wisconsin and some of the surrounding states, they're seeing this influenza A virus spread throughout college populations. And I think I reported on that maybe on our last call here or at the Board of Health meeting last week. There was a 700-person outbreak that was found in a nearby college. So it does spread really, really quickly once it gets in, especially if the populations are not vaccinated. This is a tricky question, and I have an answer for you, but the answer is not, it's not all inclusive. So I can tell you that of the tests that have been run and reported to the health department, they have been 22 years old and down, with a significant portion being in that younger school-aged population. Influenza is not a reportable illness. Like every case of influenza is not reportable to the health department. So it could be possible that we have people in other age groups being tested in other areas outside of Pepin County. I spoke specifically when looking at this potential outbreak of more of school-age children. I spoke specifically to Advent Health. So they were able to share with me the ages. They did not need to report that to me, but because they saw something that did not look normal, it looked a little suspicious of an outbreak, then that's when partners report. Now, if we had a 75-year-old male that reported to Mayo, and it was only one case and his influenza was positive and they sent him home, that case would not be reported to me. So I don't always get that report. Influenza is reportable when it's a pediatric death or a hospitalization. We have not had any hospitalizations that I'm aware of at this point.
Okay.
Or pediatric deaths.
And basically the one thing that's similar to prevent both of these is wash your hands. Don't forget, wash your hands, sneeze into your arm like you did earlier in the interview. And if you don't feel well, stay home.
Yeah, we had signs made actually when H1N1 was going around. If you recall, they were yard signs, and they said, "Stay home if sick, cover your cough, wash your hands, and get vaccinated." And we have a whole bunch of those still upstairs from that campaign, which was, I think, over 10 years ago. But the message still stays the same. It's the same mitigation strategies. It's the same prevention techniques that we can use to prevent COVID that can prevent influenza and other things, cryptosporidium, which sometimes, you touch something, you put your hands. So these are good techniques to use all the time.
All right. Well, Heidi, thanks for joining us today.
Thanks, Brian.
Pepin County Health Officer Heidi Stewart, you're listening to Real Country 1430 AM and 107.3 FM WRDN.